Good morning. Good morning, dear colleagues, ladies and gentlemen. Hello, DPA. Hello from Switzerland. Just a moment. We start with my presentation. Thank you very much for the nice introduction. DPA is a wonderful event, a wonderful congress I already could enjoy last year. And last year, as a lot of you know, we stayed in Limpopo, Polokwane, and the slogan was "From Eden come dentistry." And today, and this year, this is dentistry evolved. Dentistry evolved. And I remember really to last year event. It was absolutely great. I enjoyed very much Limpopo, Polokwane, and we were working very hard during daytime and we were celebrating at nighttime. This was an unforgettable moment in my dentistry lifetime, and I think even now we have Corona time with lockdown in a lot of countries. We have a lot of problems in every country, also in Switzerland, but I think we have to live really the dental community. And now we are doing this on a virtual way, but it's functioning. So let's go ahead and to the topic of my presentation. My presentation is today Tetric N line, a composite line from Ivoclar Vivadent, and it stays in terms of efficiency and aesthetics in direct composite restorations. I got a wonderful introduction from my colleague. Thank you very much. Nothing to add. We have now morning. Also, the weather is not so bad. Snow is coming in November. This is the normal thing. And you heard that I'm affiliated to the Zurich University on one thing, but I'm practitioner, like most of you. I have my own clinic since over 35 years, so I'm really confronted with the daily problems, and I think we are speaking on the same level. So I have dentistry done over 40 years. I'm still doing restorations. I'm still treating patients. And you see me at the upper left in my own clinic. On the lower right, this was last year in India. I traveling a lot, not now, but I got a lot of experiences. I could see a lot of approaches of my colleagues worldwide. So I think I'm familiar. I'm really familiar with the problems, with the daily problems. And I think we have to speak together to find nice solutions for every country. And when you are looking at our patients, the patient's demand for beautiful smile is greater than ever. And our patients want a perfect optical integration of every restoration. This is the major objective. This is the wish of all patients worldwide. Healthy teeth, wonderful smiling teeth, and healthy gums. That's it. But we as professionals, I think we should never forget, aesthetics is really strongly related to functionality. You cannot do veneers in the anteriors and never have a look at the posterior region. How is the occlusion? How is the side shift? Aesthetics are really strongly related to functionality. And another point, you all are aware, the teeth of our patients, they tell us a lot about the health of the patients, about the diligence, the hygiene, the lifestyle, the nutrition, not to forget. In every country, you have different nutrition. Very hard food, soft food, junk food, all the things. and also stress. More and more we see in Europe, people, they have a lot of abrasion because of clenching, because of pressing, because of stress in their daily work. So the teeth tell us a lot about the lifestyle of our patients. One thing I think we should never forget: functionality. It is so simple. We all learned that. Contact points, interproximal contact points. You see this first molar caries, secondary caries. I had to do this restoration. Much more important for the patient is at the end the nice contact point. We check it with the floss. If you feel a resistance, you did a good job. If you fall down, our job was not so perfectly. Because the patient, if he can chew, if he has no food impaction, no inflammation, he's happy. This is the first thing. Aesthetic, sure. But when you have a wonderful aesthetic class 2 restoration and no contact point, the patient is coming back to us complaining, oh, hey, I'm not so happy. This is the story we all know. What are basically the patient's expectations? They want aesthetics, that's clear. Longevity of restorations. Functionality, we discussed. And they appreciate also a short treatment time. Painless and comfortable treatment. Nobody is so happy of our patients to come to us, you know. They're okay, they're coming, and you have friends among them, it's okay, but they are not so excited to come, you know. If you have to take out your drilling equipment, they are not so happy. And then the last point, no postoperative sensitivity. These are basically the patient's expectations. On the other side, we dentists, we professionals, we have also expectations. We would like to work in a nice environment, in a healthy situation. When you're doing a crown preparation, we don't like if you have inflammation around the gingiva and such stuff. It makes no sense for us, and we cannot do perfect work. So this is the job of our patients, healthcare management. We have to support them, we have to consult them, that's clear. But this is our expectation from the patient. Now, when we are looking at the restorations options, nowadays, today we have, look at this pyramid. On the top, we have indirect digital. Digital is for me the future. I was actively working at the university when the CEREC system has been invented by my colleague Werner Mörmann 35 years ago, my friends. It took 35 years until now the digital things are so developed that we can use it. I remember very well 35 years ago, it was a disaster. Something was not functioning. We couldn't register to buy it and such things. Nowadays, it's absolutely working. It's working. It is, as we all know, it is not a cheap equipment. It costs a lot of money, but it's really working. It's absolutely working. And so restorations option, as I said, at the top we have digital, CAD/CAM, chairside milling, lap milling, all these things. And in the middle, we have direct composite restorations, our daily work. Most of our work is direct composite restorations worldwide. And on the bottom, we have basic. And some of you remember last year I had presentation about Tetric N, this powder liquid volume replacement material, composite, but simple to replace amalgam and glass universe cement. Just, you know, you remember mixing and puff, that's it, volume replacement. Conventional, quick and easy. But today I want to talk to you, to discuss with you the top of the pyramid, aesthetic and high-grade adhesive technology. We have wonderful products. not only from Ivoclar, you have from other companies, you have really high-end products. Here from Ivoclar, you remember the Tetric N serum, Tetric N serum, Tetric N flow, Tetric N serum bulk fill, Tetric N flow bulk fill. These are wonderful products, but these products are expensive. This is one thing, and also it is not always so easy to use them. You need really sophisticated protocols. Now, we learned the layering technique. This is commonly claimed today to reproduce the natural aspects of the dentition. That's true. It's working. We developed this in Zurich University in the 70s. We were teaching about the vertical layering, about the horizontal layering, all these things. It's wonderful, you know. Just a moment, I have to go back. You have a first layer, a flowable, then you have 2, 3, 4 layers to build up the restoration. Takes a lot of time. It's working, it's fascinating. But do we have always time to do this? Or is there another chance to do the same quality, but faster, more efficiently? If you look at these restorations done by, at first, by the first layer of flowable materials and building up several layers, it's working, it's great. Or when you're looking such cavities, class 2 cavities, okay, you build it up, it takes a lot of time. It's fascinating, it's working. But maybe we have other developments, and we have it now, I can tell you. On one point, we have to discuss about the restorations. For me, a successful restoration should be invisible on a speaking distance. When we are chatting, when we are closer, now we have social distance with the mask, it's okay. But normally, when we see us in the dental community, with our friends, outside, in a restaurant, the speaking distance is always the same. And a successful restoration should be invisible. Another point is an aesthetic restoration. When you are treating a movie star or a football player or whatever, which is appearing sometimes on the television, then we have to pay attention, because an aesthetic restoration is invisible at a large magnification. When the camera comes close, you can see the second molar. You can see really also the distal side of the first molar and all these things. So we have to see this differentiation. Normally, is the first point invisible on speaking distance. And this is absolutely working. This is absolutely working. So when you look at this case, I did this first molar restoration, replacing an old amalgam. You see the second molar without any restoration, a natural fissure system. There is also a way to imitate now with painting colors and all these things, you know, the fissure system. The question is, do we need this? Is this really appreciated from the patients? 2 years ago, I had a patient, he told me, oh, I don't need fissure system. This looks like caries. This looks like beginning caries. I want a white surface. And in my old, really long experience, a lot of patients tell me, hey, it's really, I want white restorations, nothing more, nothing more. So I think we have to ask the patient, we have to discuss the patient, is this necessary for her, for him? And then we have to take our decisions. Because the first molar restoration looks fine. We don't have to indicate these things. So I go ahead with this Tetric N line. Composite for anterior and posterior. Sorry. So, Tetric N line. composite for anterior and posterior restorations. Efficient solution for all cavities. As I mentioned at the beginning, to make it a little bit more efficient, more faster. Tetric N ceram, this is a material we have since several years. It's a wonderful material. Now, additionally, we have Tetric N flow bulk fill materials, 4 millimeter composite, 4 millimeter curing is possible. How to use and when to use. So, Ironclad developed the slogan efficient aesthetics. It will mean it is a portfolio of coordinated products for direct restorative procedures. A portfolio. Coordination, this is the word. But we want to maintain high quality. Absolutely, we want to maintain this. So, what we need at first, we need isolation. Aesthetics without isolation is not working. But I'm familiar with the daily practice. Rubber dam is not always possible. Sometimes we have just cotton rolls possible. And isolation, as you know, is also the base for a long-term success. Absolutely. So, one product from this portfolio is Optragate. Maybe you are familiar with this. You could see it already. It is just a lip and cheek retractor. It's very handy and it's working in the daily practice because a lot of my colleagues worldwide, in Africa, in Asia, they don't have always a dental assistant, a chairside assistant. They are working alone. So it is very helpful to have this retraction of lips and cheeks. So I have a relative isolation and I get an enlarged treatment field. And you can imagine really minimizing the risk of contamination. It is a flexible material, soft material. It's adjustable to the movements. You even can check the occlusion with this. You don't have to remove it. You can add cotton rolls. It is really easy. It is well tolerated. And you have on the foil package, you have marks to see and to measure the distance between the corners of the mouth. Because kids have smaller distances, normal adults have larger ones. So this Optragate is available for as junior, for the kids, small, for small corners of the mouth, and on the regular ones. And it's really easy and helpful. So you see it in place. You can focus really on your working field. It is a relative isolation, but very effective. And there are a lot of indications, application possibilities, checkup, professional care, direct restoratives. You can do class 5, it's wonderful. Cementation of crowns, digital dentistry, scanning, whitening teeth, and also the kids are feeling very comfortable with this. So, and moreover, you have more efficiency. And there are studies in Germany and in France, you can gain up to 15% of your treatment time you can gain. And now, my friends, my colleagues, we are all aware that we dental professionals are belonging to the high risk group in these times of COVID-19. That's clear. The problem are the droplets and the aerosols, and we have to protect ourselves. We have to protect the patients. This is our problem in every country. You have regulations, you have tools, you have advices, recommendations how to handle this. And one thing I can tell you, the best thing for us, the dental professionals, are really a pure rubber dam. It takes a little bit more time. You need some training, but it is really the best protection for both, for the patient and for us. There are already a lot of studies in terms of corona disease from China. That's clear. Transmission routes of 2019 COVID and controls in dental practice. You know all these problems with respiratory syndromes coming out from this pandemic disease. There are a lot of studies starting now, and I think really rubber dam is the best protection. It is easy, just some tricks. To fix rubber dam in the anteriors, you can do it the best with dental floss, with waxed floss, because when you are doing a nut, it will hold. It is easy. And with some clamps in the posterior. You see here some clamps in the posterior. It is absolutely working. And we all know, really, for long-lasting results, it is still the best, because you can avoid the contamination of the after the edging procedure, of the edged enamel with sulcus fluid, with saliva, with blood, and all these things. You know, it's really the best. It takes a little bit of time, some training, but I know also the reality. I tell you, Switzerland, our dentistry is not so bad, but only 15% of all dentists in Switzerland are using regularly rubber dam. 15%. In Germany, 10%. Nothing more. Okay. We are just arriving at this rubber dam. Ivoclar has also a special Optra dam, a rubber dam, which is, I have to add, really very easy to applicate. And as we know, it's really reducing the spread of aerosols and microorganisms. So this is the problem nowadays we are facing. We need an absolute isolation as a barrier. This is the best. Optragate is the other point. It's working with cut and rolls. In a lot of cases, it is more simple. I agree. So this Optra dam is a three-dimensional flexible plastic ring. It is prefabricated. You just have to punch the holes for the teeth you want to isolate, and then you easily can fix to the patient. And it looks in this way. You are punching the holes for the teeth, insertion into the mouth corners, and the Optra dam fixation is easy done with floss, as I told you, and it seals at the cervical region. And with floss, you can fix also in the posterior region, or with clamps, with the old-fashioned clamps. It's working. So you have these two things, the Optra dam, the most effective one, and Optragate. But I'm using both, and I tell you, in these times, it's the only way really to work properly and to protect ourselves and the patient. Now, some words about the preparation. We have to differentiate primary lesions, primary carious lesions. It will mean when there is not yet an existing restoration. So primary lesions, we are doing in this way to save tooth substance, tooth material, defect-oriented preparation. This is the adhesive preparation technique. And nowadays, really, this is the future, defect-oriented cavity. But for this, my friends, we need really very sharply cutting instruments, smaller instruments, maybe smaller excavators. We all learned, you and me, black classification, the black rules, you know, extension for prevention. We cut it away a lot of material. Nowadays, it is over. We have to adapt. We have to save the tooth substance. And one thing is, we learned retention, macro retention. This is, you can fix a ship, you know, with the big grooves and really the undercuts. Okay, but nowadays we have adhesive technology. This is micro retention. You see, these small legs, you know, these footprints on the plant, this is micro retention. This is high tech. Macro retention, there's a big thing, you know, with the big burrs. But still, in class 5, you need maybe a small groove, but you can do it. And I show you also another point. This is the adhesive preparation. We just take out the carious material. We are beveling. This is for the primary lesions. When you remove an old amalgam restoration, you have to do sometimes some enable grooving or something like that. It's depending on the case. The burrs. I arranged and I assembled this set for 6 burrs about 20 years ago. I'm working 80% of all my restorations I do just with these 6 burrs. The blue ones have a surface of 80 micron, a rough diamond for the preparation. I have the ball for initial caries to start, the small cylinder for premolars, the big one for the molars. And the red ones have only 40 microns, are smooth, is for the beveling and the basic finishing for every composite restoration. Okay, for the finishing, I come back afterwards. You have some silicone rubber wheels, diamond rubber wheels, all this stuff to do high polishing. But this is for basic, just for occlusion. And the point is really to select a high quality instrument. You have better quality cavities and it goes faster. It goes absolutely faster. I just showed you, this is a Swiss company that really invented these burrs. And the most important thing is the homogeneous distribution of the diamond grains on the shank. And then the fixation of the diamond particles, that's the other point. So you can reuse these burrs. And at the end, these diamond particles are with chrome plated and fixed. And these burrs are really high-end burrs. That's why I reduced just to 6. It's okay. You can drill with this about 3 hours continuously. Always disinfect, sterilize, that's clear. But you can use it for 3 hours. This makes sense. This makes absolutely sense to reuse it. But, okay, they are a little bit more expensive than the cheaper ones, but they lasting longer. And you have really then nice cavities, a nice cavity cutting. Or look this. I did this removal of amalgam restorations. You can really do nice, really nice preparations with this, with a high cutting burr, diamonds. Okay? Now, we learned beveling. Beveling, I'm still doing also with the normal manual 40 micron grain size diamonds, but there are new instruments, oscillating instruments. This is, for me, especially fascinating when you're doing inlays or something like that in the proximal side, because in the proximal side to do the beveling, to do the finishing of the margins is not always easy. You agree with me? This is a new type of instrument, which is really nice. Deep cavities, some word. If you really have deep cavities after removal of amalgam, old restorations, then close to the pulp not yet open, close to the pulp, when it is shining through a little bit the pulp, just protecting by calcium hydroxide layer, but just, a point, it's not a lining, and then cover it by glacier cement. And then you can start with your restoration. A point. I mentioned in the beginning, contact point. This is the thing, glacier cement in the posterior region. For permanent restorations, it's not working because it is not hard enough. It is not strong enough. And this is a study from the Amsterdam University. They showed over 6-year period, glacier cement is not working here. In the interiors, class 5 is okay, no problem, but not in the posterior. It is not strong enough. And then you see on the right-hand side what happens. You have foot impaction, the loss of proximal contact point, inflammation, formation of pocket. You have a perio case and the patient is complaining. We have to avoid. It is not always easy to create contact points, I know. But also my friend from South Africa, I met last year, we both know that you need a material which has a strength of at least 80 megapascal in the posterior region. Have a look, not below. It is not strong enough. That's why glass universal cements only have up to 36 catacomolar, for example. It is not working in the posterior region. We need a strong material, more than 80 megapascal. These are facts, these are studies we know worldwide. Some words about wedging. I'm using always wood wedges, and I tell you why. Because wood is expanding underwater. So before I'm doing the preparation, I push a wood wedge into the interdental area, and then under my preparation, underwater, then I already have an expansion. So after preparation, I take away my wood wedge, place immediately a matrix, plastic, metal, selective matrices, whatever you are using, and push back my wood wedge. It is working. But this must be a fast procedure. Don't wait too long time. And then you really get nice contact points. It's working. It's absolutely working. Another point we should never forget. Before I'm doing a final restoration in the posterior and the anteriors, I'm always using shortly. This takes you 20 seconds, 30 seconds. A polishing paste without fluoride during every restorative treatment. You see below my case, I already did the restoration at the mesial side of the lateral incisor. I already did the beveling. And then before I'm coming with the acid edge procedure, I'm really doing a cleaning with this peroxide without fluoride. And I tell you why. I removed the acquired enamel pellicle. What's pellicle? It is not tobacco stain. It is not tea stain. It is not biofilm. It is a small layer of salivary proteins from the saliva. Everybody has, you and me. And when I remove this, before I do every restoration, this is high-end adhesive technology. You have 60% better, long-lasting restorations and more aesthetically. It's very simple, but a lot of colleagues, a lot of friends forget this. It is a short action. And it should be without fluoride. Some words about acid technology. 1956, Buonocuore introduced acid etching. It was a fantastic area started with this. And I have an increased surface, with the mountain and valleys. This is an enlargement of a factor 1000. And you can imagine, the better isolation field I have with Optragate, Optradam, with Rubberdam, with everything, with cotton rolls, the better isolation I have, the better surface increase I have. When you have some humidity, it goes down to 500. So don't forget this in your mind. A nice operation field helps to do long-lasting restorations. Now, bonding. Bonding, basically, we have two problems. Because the tooth is hydrophilic and the composite is hydrophobic. We need a material, a bonding, which is bridging both. Okay? Tetric N bond universal. This universal is well known now since years, and it's really working. It's working effectively. You can really use this for every restoration. You can use it with all etching technologies, and it is faster. Tetric N bond universal is optimized because we have a mix of monomers inside with hydrophilic and hydrophobic properties, both to bridge it. And also the acidic concentration. There is acidic inside, that's clear, because some edging I need, you know. Then this is mild. So I have less postoperative problems with this. And it's existing with the old-fashioned bottle and also the Viva pen. The Viva pen is really fascinating. You know, this is like this pen. Tack. It's really working. It's working. It's fascinating. It's an innovative product for me. Absolutely. Tetric N bond universal is compatible with all etching techniques. The self etch, you know, just take out with the bottle or with the pen, you know, it is absolutely a minimum treatment time with a reduced risk of postoperative sensitivity. Then you are aware, selective enamel etch. For me, it is only working when you clearly see the margins of your preparation. For me, it looks nice. You know, selective will mean I just etching the enamel. It's okay. But it's a little bit, very sorry, academic. Because in the interdental area, when you are doing restoration at the second lower molar, we all know you don't see exactly the margin of the enamel. You don't see it really in practice. So for me, this is, when it is visible, okay, you can use it. For me, total edge, still fine also. That's clear. Because I have maximum adhesion to enamel and dentin, okay? And it is really working. So Tetric N bond universal, it is a time-saving tool and is only working in 35 seconds. So with the Viva pen, you click and then the brush is already wet. And we should never forget, we have to agitate and actively scrub at least 20 seconds. 20 seconds, not 10, 20. If you want more, it makes no sense, but 20 seconds. Then disperse with the air, gently, please, not in this way, gently, and then light cure 10 seconds. Then it's over. The total bonding procedure is over. And then you can start with the bulk fill composites. These are the 4 millimeter composites. Now, Tetric N ceramic bulk fill. You ask, why should I use this? Why? I'm more efficient. I can rise the efficiency. And the other point is, I can really increase and rise the process safety. It's interesting. There are studies that about 60% of the clinical success of a restoration is depending on us, on our skills. Only 40% of material. It's nice for us to know because we learn this skill. We are working daily with our skills. So we can really increase the process safety because we can also, with bulk fill materials, with the 4 millimeter composites, we can do higher curing depths, up to 4 millimeter, and we have lower risk of voids, air bubbles, due to wrong handling, and the postoperative sensitivities are also less, absolutely less. So bulk fill makes sense, makes absolutely sense. I have a low shrinkage stress. There is inside a light sensitivity filter, shade polymerization controller, okay. And I have an optimized composition of the monomers and fillers, fluorescent dye, and the newest type of photo initiator. And I show you, this is a fascinating thing, the last point, Essential technology. It will mean the material has a low translucency, has a high translucency, and goes to dentin opaque translucency after polymerization. It is a change. I show you this, and this is really fascinating. So just basically, I'm using Tetric N bond universal, the bonding, and then light curing, and then Tetric N ceramic bulk fill, 4 millimeter. It's okay. You adapt it with some instruments, with Uptersculpt, for example, light curing. That's it. That's it. It goes much faster. I give you some overview, not to make it more complicated, where to use this Tetric N line composites. As you can see, at first we have the sculptable ones, the conventional ones. These are Tetric N ceram. Tetric N ceram has the most shades available, 11 shades. I'm not using 11 shades. Maybe some of you. 3 dentin shades. It's wonderful. It's the sculptable one. And the indication is clearly for every class 1 to 5. That's clear. But this is the time-consuming procedure, the layering procedure. Then we have the flowable ones. Tetric N flow. We are using this, I'm using this mostly as liner in all the cavities 1 to 5 because it has a perfect masking ability. Masking the discoloration of the old amalgam discoloration you have really mostly in the posterior region. I don't have so many shades here, makes also no sense. This is wonderful, just as liner. Then we go to the 4mm composites. 4mm composites. The sculptable ones are the Tetric N ceram bulk fill. And it is mostly indicated, I'm using this for the posterior region, class 1, class 2, sometimes class 5, but mostly class 1, class 2, the posterior region. And I have only 3 universal shades here, that's okay. And then below the 4mm composites, I have also the flowable ones. This is the Tetric N flow bulk fill. And this I'm using as base, as 4mm base in deep cavities, class 1 and class 2 posteriors. Basically, the bulk fill materials are for class 1 and 2 in the posterior region. And here I have this essential defect. I get a dentin-like translucency after the polymerization. And what is interesting, when I place it, it has a self-leveling effect. I place it and it will level itself in the cavity. This is the most important property. So when I have class 1 and 2, the question is always, how deep is the cavity? When I have in the class 1 and 2, if the cavity is not so deep, okay, I'm just using Tetric N ceram bulk fill, nothing more. When it is really deep cavity, you can use the Tetric N flow to mask the discoloration and then add Tetric N ceram bulk fill. We have this point. On one side, we need efficiency and we like it, but we want to maintain aesthetic quality. That's the point. Next. So, one word about the light refraction and the shade match. Also, a lot of companies, dental manufacturers are talking, discussing the so-called chameleon effect. Also, Ivoclar has this chameleon effect with Tetric. This is well known. And all the companies always promote this. What is this really? When I have the light, what will mean transparent material? Transparent material will mean that the light goes completely 100% through. This is transparent. Translucent will mean that the light goes through, but I have some refraction. So some light goes back or in another direction. And then an opaque material has complete reflection. Everything is reflected. So this makes the material opaque. This is the story. So translucent, I have some refraction. And in all the dental materials, they show some refractive index. How much the light goes through, how much the light is reflected. Next. We know that the composition of composite, I have monomers. It is like a soup, about 40% by weight. And then there are some additives, some photoinitiators, and then about 60 till 80% are the fillers. This is the story. So, oh, just a moment. Okay. So the monomer is the liquid, and the fillers are the ceramic fillers. And we should have a refracting index which is similar between the fillers and the liquid. Now, next. So I need optical properties of the monomers and the fillers. For example, when the liquid is in the bottle here, in the glass, and the glass rod is the ceramic filler, when I don't see the glass rod, then I really have a similar interaction of the refraction. So this is the story. Next. Okay. This essential technology is really innovative. This is with this Tetric N flow bulk fill material, N flow bulk fill. It is translucent to 28%. So the light can go absolutely through 4 millimeter. And then during polymerization, it changes to dentin-like translucency. So this is the fascinating thing. At the end, I have dentin-like core, a dentin-like core. And at the beginning, I have translucent. Next. I have less shrinkage because in the Tetric N ceram bulk fill and Tetric N flow bulk fill material, there is a shrinkage stress reliever. You see this big filler, and it acts like a micro spring, a spring. It goes out. The retraction, the shrinkage is always in this way, towards the center of the mass. And the spring goes in the reverse reaction. So this is really neutralizing the shrinkage. That's why I have less shrinkage with this bulk fill materials, thanks to this shrinkage stress reliever. Next. So this is the summary of all these products, of this Tetric line. I told you, Tetric N ceram, well-known, proven. Tetric N flow, the only difference is Tetric N flow to mask the discoloration. This has pixotropy. This is a pixotropic material. What is pixotropic? When I touch it with my instrument, it flows, it creeps. When I stop, it stays. Then Tetric N ceram has the absolutely advantage of a high curing depth, 4 millimeter. And Tetric N flow bulk fill, the difference is this essential effect. I have a high translucency at first, and then it changes to dentin-like to a lower one. This is the story. Next. So, Tetric N ceram, well known. I have a lot of shades, up to 16 shades. You can use for every class. Next. The Tetric N flow, as I told you, for masking, and it is pixotropic. It flows under pressure. Next. So I'm using this for an extended fissure sealing. Next, this is acid etching. After I'm rinsing away the acid, so you see a small cavity I have. The mesial part, I'm doing a fissure sealing, a normal fissure sealing, opaque fissure sealing, and here on the distal part, the small cavity, I'm using Tetric N flow. Next. Pixotrop, under pressure it flows, and when I go away with my instrument, it stays. That's the story. Next. You see this now, how I did now this solution. Distal, Tetric flow, and ahead in the mesial part, the normal fissure system. This we call the extended fissure sealings. It is easy to do. It is saving tooth material, tooth substance. Next. So the Tetric N Ceram bulk fill, as I told you, the only difference to Tetric N Ceram is I have a high depth of cure, 4 millimeter. 4 millimeter. Next. And at the end, the Tetric N Flow bulk fill. This is the 4 millimeter composite. You can work faster, 4 millimeter you can fill. And I have really then at first high translucency and then changing to low translucency, dentin-like. Next. So it works in this way. Efficiency and complete range of shades. I can do 4 millimeter at the bottom, light curing, and then Tetric N Ceram for high aesthetics, because you have many shades. This is one possibility to do. Next. Then, the other point, you see it here again. I'm filling 4 millimeter, then I can fill the next layer, the up layer, up to 2 millimeter. Always 10-second light curing with a light curing equipment. The blue phase with over 1000 milliwatt per square centimeter. 10 seconds, it's okay. And if you are using Tetric N Ceram, you can sculpt if necessary. Light cure, finishing, that's it. So really, you become more efficient, absolutely more efficient. Next. Some words about light curing. I don't want to give you some physical lectures about these things. What you should always keep in mind, the direction should be vertical in a right angle to the surface to have an optimal polymerization. And go as close as possible, but always check, and this you should do, your dental assistant should do, always check the window, the exit window of your equipment, because sometimes you touch, you don't realize it, you touch the surface and then it is covered partially with bonding. Please check it. This makes sometimes 50% of your light source is away. So check the exit window of your photocuring. Next. And one thing we should always know, the shrinkage, the polymerization shrinkage always goes toward the light. So in the interdental area, sometimes I have to adjust the angle to have an optimal polymerization. Next. I don't show you hundreds of clinical cases, makes no sense because you are working like me every day. This is a solution, Tetric N Flow bulk fill, 4 millimeter, combined with Tetric N Ceram. At the right hand side, 2 years in place. It's working fantastically. Next. Some tools which I'm using, not every tool, are this really time-saving contouring sticks with anti-stick properties. They are sometimes really better than, absolutely better than spatulas. Next. There are 4 types available. It is a pad. When you have larger surfaces, then there is a chisel. I like this chisel most because you can really create the marginal ridges very fast. Point, I don't need so much, and the ball for the adaptation of the material. The chisel is wonderful. Chisel is wonderful to do the marginal ridges. Next. So this case, just coming to the end, you see at first the cavity, then placement of the matrix, acid edge, total edge, then drying, rinsing out, drying, then application self-edge procedure with the Tetric N Bond Universal, really agitating, scrubbing, at least 20 seconds. Smoothly dry it with your air blower, light polymerization. Next. And then I'm applicating the Tetric N flow bulk fill. You see it is translucent. Then light curing, and then it becomes much more opaque. Okay? And then I can add Tetric N serum bulk fill here, Tetric N serum, light curing, and you see the result. It's really working. Next. Finishing, as I told you, I'm just taking for the basic finishing, this is 40 micron diamonds. And don't forget, centric occlusion is one thing, but in the posterior region, I always see a lot of cases, and also myself, sometimes we forget it. The lateral movements, the side shifts are so important. Next. To do final finishing, Ivoclar developed Optraglass. These are wheels and silicon diamond based. There are silicon based wheels and covered with some small particles of diamond. This gives you a brilliant finish and really a wonderful surface. There's no question. Next. You see a flame available lens, the cup, and the spiral wheel is really nice. But you should use it, that's clear, also with some water irrigation, not to do it only water, because it becomes too hot, that's clear. But basically, I told you my diamonds. This is the basic, and then you can add as much as you want and need. Next. So I'm coming to the end. Failure analysis. There are a lot of studies, which is the main reason for failure of composite restorations. And basically, these are fractures. Fractures because we didn't respect the occlusion, we didn't respect the individual environment of the patients. Next. Okay. Yeah. Prevention of fractures. We have to know the material-related parameters. Which material you are using. If you are using Ivoclar, if you are using Kerr, if you are using Driam, whatever, we should absolutely know how is the material functioning. I always see a lot of problems because, when the manufacturer tells you, please do the polymerization 20 seconds, you have to do because they know it. When they tell you the bonding has to be applied in 2 layers, do it. These are the material-related parameters. Restoration-related parameters. This is our preparation technique. We should really estimate, we should analyze if really the enamel shell is too thin and we see a very sharp occlusion, then we have to reduce. Patient-related parameters, clenching, pressing, such things. Opening of the mouth, it's also a point we have to respect. Okay, next. So this Tetric N line is really of reliable quality. I have nice radiopacity since years. We know this since 20 years because there is ytterbium trifluoride inside is the best indicator for radiopacity. Low shrinkage, as I told you, with this micro spring filler, which is acting like a micro spring to compensate the retraction. I have a long working time. I can really sculpt if necessary, and short curing times. All this is 10 seconds with the blue face. Okay, next. Okay, thank you. So you see, simplicity meets aesthetics. It is no contradiction. It is working, and we want to have still high aesthetic, high quality. So Tetric N Bond Universal in the bottle, or the Viva pen, the pencil, that's great. Then the basic Tetric N serum, we know since years. Then the Tetric N flow material, for masking the discoloration. Tetric N flow bulk fill with the essential effect, becoming from translucent to opaque. That's great. So this makes it really more efficient and really faster. Absolutely. Next. So you get radiant smile, nice teeth, and you can really provide to your patients. Next. This radiant smile, and you don't know the smiling gives a confident appearance and a feeling of well-being. That's it. Next. So, my friends, we are coming really to the end. I thank you very much.